Hi everyone, welcome to our channel. In this video, I am going to explain about the parts of the eye and the problems affecting the eye. We all know eye helps in vision and it presents in a protective bony socket which is called as orbit. To explain in detail the parts of the eye has three layers: the outer layer, which middle layer, and the inner layer. In the outer layer, we have the sclera and cornea. We all know when we see from the front, the eye contains a white component which is called as the sclera. Whereas the cornea, it is a transparent structure which is present in the center. That is called as the cornea. Behind the cornea, we have a middle layer which contains the iris and pupil. Iris, we all know it is a black color circular structure. It is round in shape. This is the iris, and in the iris there is a small aperture. We call it as pupil. When we focus, the pupil size will dilate or constrict, etc. Behind the iris or pupil, we have lens. This lens helps in the focus of light into the retina. And in the inner layer, we have a retina which has some light detecting components or photosensors will be there, which creates an impulse and transmits to the optic nerve so that an image is created. And most importantly, we commonly come across the word called conjunctiva. What is conjunctiva? Conjunctiva, it's not a part, but it is a lining which lines the sclera. This conjunctiva helps to keep the eye moist. Remember, this conjunctiva lines the sclera, okay? And in between these parts of the eye, there are some chambers will be seen: anterior chamber, posterior chamber, vitreous chamber, etc. In this anterior chamber, a liquid fluid is filled, which is called as aqueous humor. In the posterior chamber, vitreous fluid is there. This is all about the eye parts. Now we're gonna see the different problems associated with the eye. We all know the sclera. Sclera is the white part which we will see in front of the eye. If there is an inflammation in the sclera, we call it as scleritis. In some conditions, like if there is any jaundice or any liver problem, the whitish sclera becomes yellow. This yellowish sclera will be seen in jaundice liver problem. In some conditions, like if there is any genetic problem, bone problem, or in conditions with osteogenesis imperfecta, the sclera becomes blue. This is the bluish sclera. And if there is any eye injury, the sclera becomes red. This is all about the sclera problems. Now we're gonna see about the problem associated with the cornea. If there is any infection or inflammation in the cornea, we call that condition as corneal keratitis. We generally come across the dry eyes where the eyes does not produce enough tears, and we also see some corneal ulcers, abrasions, etc. And we come across a word called pterygium. What is pterygium? Pterygium is nothing but there is a fibrous overgrowth will be seen on the cornea which extends into the sclera. And in some conditions called keratoconus, in the keratoconus, the cornea becomes thin and bulges like a cone shape. We call this condition as keratoconus. This is all about the problems associated with the cornea. If there is any problem associated with the iris, we call them as uveitis. Next comes the problems of lens. If the lens becomes cloudy or because of the protein deposition, the lens becomes cloudy, we call that condition as cataract. In cataract, there will be reduced or blurred vision will be there. And other most common eye problem is conjunctivitis. In conjunctivitis, the conjunctiva, which lines the sclera, becomes pink or red. We call them as pink eye or conjunctivitis. And other problem, we all know that there is some fluid in the eye called aqueous humor. If there is any imbalances or increased or decreased in the aqueous fluid, there will be increased intraocular pressure will be seen, which called as glaucoma. and if there is any inflammation or infection in the eyelids, we call that condition as blepharitis. And most importantly, when coming to the eyes, we all know we come across two words: myopia, which is the nearsightedness, hyperopia, which is the farsightedness. In myopia or nearsightedness, we have a difficulty in seeing the distant objects, whereas in hyperopia or farsightedness, we have difficulty in seeing the nearby objects. This myopia or hyperopia usually occurs because of differences in the size of eyeball or cornea curvature, etc. Coming to the astigmatism, what is astigmatism? In this, the cornea and the lens, they have a different shape rather than the normal. Because of this, there will be blurred vision. And most importantly, some people will come across a squint eye, which is called as strabismus or cross eye. It usually occurs because of the problems associated with the eye muscle or nerve associated with the eyes, etc. This is all about the problems of eye problems and their diseases and names. Hope you like the video. If you like the video, please share and subscribe our channel. Thank you.